In your health news tonight, is 50 the new 30? Those in their 50s are the most likely age group to have some sort of cosmetic surgery every year, with millions performed last year alone. So what are the most common aging concerns and what are the treatment options? Joining me now to talk more about this is Dr. William Groff. So I guess, first of all, what are the most common concerns for this age group?
Well, in the 50-year age range, most patients are concerned about wrinkles and loss of skin elasticity or loose skin. So, there's been multiple attempts in the past few years to find a device that will actually predictably tighten the skin. And finally, I think we have something to be really excited about, a great new technology. It's called ThermiTight or ThermiLift. And it's minimally invasive, which means it's non-surgical, so patients can go right back to work, and it's pretty amazing stuff.
So I guess tell me a little bit more about the non-invasive procedure. If you're talking about someone who is worried about loose skin or wrinkles on their face, what does it do?
What it does, actually, I have a probe here I brought, which you can take a look at. It's actually smaller than the size of a piece of spaghetti. Wow. And you can see at the tip here, there's a little metal piece, and at that piece there, heat is generated. So I can adjust the temperature of this probe, and at certain temperatures, the skin will tighten or contract, and at a little bit higher temperature, it will actually melt fat. So what we do is we numb up the skin in the neck area, for example, and we can pass this probe underneath the skin. So it actually will go underneath the skin, and it's painless because the area is numbed up, and then I can deliver heat all through that area, say underneath the chin, the jowl area, and I can get instant tissue contraction and tightening, and I can also melt fat. So it's amazing. It really tightens up the neck well.
Now, is there any downtime with that? I mean, I know it's non-invasive, but that looks a little scary.
Well, it's not, don't be scared. It's perfectly safe. But what does happen is afterwards there can be some swelling. But when you compare a procedure where you can be awake and drive yourself home to, say, a face or neck lift where there's significant downtime, there's risk of scarring, there can be all kinds of problems with bleeding, infection, and so forth. This is a really fantastic device and really yields some really nice results.
You know, in the age group we're talking about 40 to 50, or actually we started with 30 to 50, which is crazy. It's not just women, though. Men are also getting in on this.
Oh, yeah. Well, San Diego in particular, it's amazing. You walk around and everyone looks great. I mean, everyone's fit, they work out, their skin looks good. I mean, people in San Diego really tend to take care of themselves. So, and we all, we feel much younger than we look a lot of times. So why not do these little things that are, that are minimally invasive or non-invasive, that we can look as great as we feel, Well,
why would someone go for from non-invasive to then a real surgical procedure? What are the differences?
Well, certainly there are some cases where surgery is the best option if there's significant loss of elasticity or significant tissues really hanging down. I mean, there's only so much that these minimally invasive devices can do. Then surgery would be a better option.
Okay, and finally, so we're talking about the ThermiLift again. Right. Is that what's the typical time frame for a procedure?
Actually, once we get the area completely numb, so it makes it a painless procedure, it only takes about maybe 45 minutes to do the neck and jowl area.
Interesting.
So not bad. Yeah, not bad.
The fountain of youth. Thanks so much, Dr. Groff. We appreciate it. All right.